Welcome back. You tuned into Educational Insights here on Salam Media. And now we're speaking, it's a privilege and honor to be speaking to dermatologist Dr. Nooren Moti. And Dr. Nooren Moti hails from a family of medical doctors, so medicine was her natural choice for her. Early on in the study, she felt drawn to the study of the skin as she believed it is the organ that reflects our inner state of health. And in addition to her interest and passion for the discipline, she decided to specialize in dermatology as a way to facilitate early diagnosis of underlying medical conditions, which often show on the skin first. So I'd like to welcome Dr. Nooren Moti on our show here on Salam Media. Assalamu alaikum and welcome to Educational Insights, Dr. Nooren Moti.
Walaikum salam. Thank you so much for having me.
And you know, in the introduction, I was just thinking you're quite right in your assessment that often underlying medical conditions first surface on the skin. And I think of sometimes in terms of growths on the body and things like that, you'd first notice it in your skin or darkening of the skin, and that is what sounds the alarm bells in terms of a deeper underlying medical condition. And I can understand that fascination that drew you to the study of dermatology.
Absolutely. And it's not also something that seems to be so overt. I mean, what we've also been noticing with this COVID-19 crisis that we are all faced with, like stress manifests on your skin in such different ways. And the skin definitely shows how you're feeling on the inside. So it's always been my passion in life. And I always say that it's just small things, not the overt pigmentation or anything that's obvious, something small, some small itch that shows exactly how you're feeling. And that's why I've always loved it.
Yes, and then conversely, you can see a person's inner happiness by that small twinkle or glow on their skin, and then you'd say, you know what, this person is, doing okay. We can tell by the skin. So I think when we come here, Dr. Nooren Moti will feel a little bit self-conscious in terms of what she's seeing. Is she seeing? Is it just skin deep, or she can see through into our souls in terms of how we are? So, Dr. Moti, you know what? I'm a person that even prior to COVID, I had this thing about germs and always washing my hands as a practice. When I came home from ever, the first thing I do is go to the basin and just give my hands a good wash. And then I feel I'm okay at home and things like that. And if we go out to dinner, I'm always the one that carried the sanitizer because if there were no taps so that to wash our hands. But what I got to think now is of late in terms of super sanitizing. Is it a good practice in terms of, especially when you're shopping? And recently I went to shopping mall looking for a specific an item, and went in the first store, and then I was asked to sanitize, and I was there for 10 minutes, and then popped around to the second store and then asked to sanitize, and I think the duration was just about 12 minutes and so on. So within a 45-minute duration, I must have sanitized about 6 or 7 times my hands. And that got me thinking, is this okay? Will it have an effect on my skin? And also, the other question is a sanitizer in terms of the chemical composition, is a sanitizer, or we need to be checking what is the chemical composition of sanitizers in terms of being safe on our skin? Because the thing is, everybody has these bottles and you don't know what. And then this will probably be a legal question, is can we then at the store to say, you can wash? I'll rather use my own sanitizer that I have with me because I have a skin condition. Please observe, I am sanitizing, but not with your product. So I've given you a few questions based on my experience because this was worrying me. And I thought, if this is a concern to me, it is a general concern in terms of super sanitizing.
Yes. So I know you experience. I've experienced it as well. The going from one shop to the other and wondering how necessary this is. And I think what we have to take it from is that the shops legally have to provide sanitizers and ensure that whoever comes into their space has been sanitized. So it's a tricky situation to say, to go from shop to shop and say I just sanitize there. So we will have to sanitize before every shop. I'm going to jump around between your questions a little bit. Legally, as far as I'm aware of, if you have your own sanitizer, you may use your own sanitizer. I haven't seen any shops being very particular in needing to use their sanitizer, and I've often seen it happen that you say that I suppose we all need to be respectful and mindful of each other, and if there seems to be a protocol that they specifically want the sanitizer to be used, there are ways around it, and I'll get to that shortly. But I haven't seen any issues where they might just ask you to sanitize on entering, and if you have your own sanitizer, you can feel completely comfortable. When sanitizing your hands, let's first put it out there. The best way to sanitize your hands is to wash your hands with soap and water. And that's really nice, because in terms of they don't mention the type of soap you need to use. And I have a lot of eczema patients, and they are using a milder soap, even a plain old Dove soap, or if you're doing your gentle moisturizing creams, and that's essentially and has been proven to be the best way to keep your hands clean. We always don't have a basin and a soap around, but I would always say, and what I'm encouraging all my patients, in your place, in your home place, don't use a sanitizer. Use soap and water, because then already you eliminating the harsh chemicals. In terms of what you needed to do, it's sort of the percentage of alcohol in your sanitizers have changed in terms of what really is required, and I think it's around 70% now that they're saying that is sufficient enough to clean your hands. There are a lot of chemicals involved in different sanitizers, and not all of them have alcohol in them, and we are often getting a irritant eczemas, if I can say, from these sanitizers. Some are chemical dependent and some are non-chemical dependent. So you would need kind of an accurate diagnosis to go ahead and find out exactly which chemicals um, you are allergic to or irritant towards. The problem, however, is that there are a lot of new chemicals around, and it's not quite specific. The tests aren't as specific as we would have liked them to be. So generally, if you're getting an irritant to one chemical, you may get it to another chemical. If we are presented with a hand condition, we are probably, or an eczema due to chemicals, you'll probably find that whatever you put on your hand starts to burn the skin. So we have to be so careful in that regard, because when you go into the shops, legally, unfortunately, the shops do need you to sanitize before entering. But what we have always is to, if my patients have a hand condition, I then encourage them to wear gloves when they're going shopping, and to rather, so when they're forced to sanitize, they'll sanitize the gloves, not their hands, and then that way the hands are protected. I think, I'm not too sure if I answered all of your questions in that.
Yes, that's what I've been doing now. After that first experience, I now just wear my gloves wherever I go. So I know if I'm going shopping, I put on a pair of gloves, and then as soon as I take them out after shopping, I then give my hands a good wash, and I think I'm good to go. Now, in terms of besides shopping, in terms of if you don't have access to soap and water, and you sanitize, how frequently should we be sanitizing? Like in terms of intervals, half an hour, how long does the composition of that sanitizer last on the skin in terms of an effective barrier?
So your hand sanitizers have different compositions, but what it comes down to is when it's keeping your hands clean. If you've sanitized your hands and you haven't touched anything that would contaminate them, then you are quite sanitized, and you're quite sanitized for a long time to come. Your efficacy in terms of how clean your hands are actually comes down to you personally, because if you touch something then I would say that you are contaminated. So you've got to sanitize again. But say you've decided to sanitize your hands and you're walking around with them closed, and you are walking around with them closed, and you don't touch anything else for however many hours, your hands are sanitized. So I think it more comes down to what contaminates and what breaks our sanitized hands, and that would be contamination of any kind. So touching any sort of buttons or whatever, or even your own, our phones, pens are, they teeming with bacteria. So when we put it in that way, when we look at it in that way, basically, I don't think many of us are having hands that are sanitized for too long.
Okay, so yeah, I'm so pleased I asked you that question because I always thought it was a duration thing, that this barrier stays on your skin for maybe 15, 20 minutes, half an hour, and now you've contextualized it so well. It's not actually the duration, but it's actually what you're going to be doing with your hands, what you get in terms of contaminants. So if
Yes,
uh, you cleaning up, so if you're cleaning up your workspace and your office space, and that there's a lot of things you're going to be touching. So even after 10 minutes of tidying up, you'll need to re-sanitize. Whereas I've come into the studio, I've sanitized everything around me, and my hands, everything. So for the full duration of the 2 hours, I'm not leaving there. There's no need then to sanitize because I've already done it. So while I was focused on the duration,
absolutely.
it's not actually the duration, it's actually what you're going to be touching in that time.
Yes. Yes, which is also important for kids to remember when they go to schools, because what the schools are doing is that they're making them sanitize their desks, and they come in with one or two pens which are sanitized. And for the duration of that lesson and the lessons thereafter, they should be adequately sanitized. And it's only if they are going to touch something that's foreign to what they've sanitized that they would have to make sure that they cleanse their hands again.
Thanks, because that is really essential in terms of you guiding us. Okay, now I'm going to throw out a question.
Another important tip
Go
that
ahead.
we
Sister Nuri, we're losing your butt there. I just want to check with Ziad if we can get you on a better, Dr.
yeah,
Nooren.
I'm also
Okay, are we?
losing.
I lost you, but there. Let me just see if Ziad can reconnect. I think we're having a connection problem there. But I see we're getting Dr. Nooren back on. Can you hear us now?
I can hear you, but it's not a very clear line.
Yeah, momentarily we lost you. Another point you were going to tell us, in addition to the what you're touching, you were going to add to that.
Yes, it's quite an important one, and it's one that I've been also advising a lot of people, is that once you've sanitized or cleaned your hands, we are recommending, because I'm sure now in winter, with it being so dry, everyone is feeling that they've got quite a little bit of eczema or dryness or itchy hands. And we're actually saying every time you sanitize your hands to try and also use a little cream and emollient as a barrier, because using barriers more commonly in your hands is actually the best way to get beyond your irritant feeling on your hands that the sanitizers are causing. And in that, we do have a little bit of a time period. We say we should try and at least put a cream on our hands at least every 6 hours to make sure that they are nicely moisturized and in between our sanitizing phase. But I tend to say to people struggling with eczema to please actually put on emollient as soon as they've washed their hands.
Okay, yeah. In fact, that was my next question, but I'm so pleased you answered that in one, because I was going to ask you. I was actually going to ask you cream before, after sanitizing, but you said after sanitizing we can add on our moisturizer, our barrier cream after sanitizing.
Yes. Yes.
Okay, perfect. And then
Yes.
I needed
And
to ask
I
you, mhm,
am always going for.
Dr. Moti, can you hear us?
Yes, I can. I can hear you. I was just going to add what I've been telling a couple of my patients now is to use actually a very thick barrier cream at night before they go to bed, just to kind of at least repair your hands at night.
Okay, so something like a body butter.
So I don't like any creams which have perfumes in them. What I'm thinking more of the
Mhm.
lines on is so yeah, like a thick, like a Vaseline type cream, like your Aquaphor from Eucerin, your Epimax has a red ultra cream. So those kind of very thick ones that don't kind of rub off the skin, I would go for something like that.
Thank you. That is highly informative in terms of at night. So at night, give your hands some reprieve, moisturize, put a thick. Especially in winter, our hands tend to get dry. Mere fact that it is winter and the air is drier, so our hands get drier, and then we are sanitizing a lot more than we had done previously. So in terms of protecting our hands in that way, is there anything else that we should be aware of in terms of sanitizing or anything to look for when we purchasing sanitizer for ourselves for personal use?
It just one of the things that we were looking at overseas is that some of them have preferred not to use very chemically originated water. I mean, chemically induced sanitizers for younger children because they are tending to find that their skin is a little bit more sensitive. I actually just think across the board, be just very careful about what you're using and use that sparingly and rather use your soap and water because we're really seeing bad eczemas happening now, and it's very, very debilitating for many patients. Also, stress doesn't help eczema. So when you have an issue with a sanitizer giving you eczema and you have a bit of underlying stress, it just makes your eczema so much worse.
Dr. Nooren Moti, thank you so much for your time. This is really valuable advice you gave us, especially this is educational insights hours. So parents out there listening, they can be more aware in terms of protecting their children's skin and also in terms of the amount and quantity of sanitizer they're going to use. And as you mentioned, if you have access at that time to soap and water, the most effective barrier in terms of keeping our hands clean is actually the soap and water and adding a good hand cream afterwards as well. Thanks so much for your time. Much appreciated and go well. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you. Thank you. Assalamu alaikum.
And that was Dr. Nooren Moti, and we were discussing sanitizing because it's become a part of our life. Who would have thought in December when we bought those little hand sanitizers because we were traveling and know that we might not have access to tap in soap and water during our vacations, and that our little hand sanitizer bottles would be supersized and it'd be all over. Excuse me, and hand sanitizer would be the order of the day. And because we were not prepared like this and the amount we're using, it's important to know these things because after all, we need to take proper care of our skin. So please, parents with younger children, I think maybe reduce, as Dr. had said, reduce the amount of sanitizer seats applied everywhere efficiently and wherever possible where we have, if we have access to soap and water, always go for the soap and water option and put cream. And I think when we tuck our little angels to bed, our little precious children to bed, let's just maybe make it a routine where we're going to put a nice thick layer of cream or berry or barrier cream on them so that inshallah while we sleep we're healing and repairing our skin and refreshing it as well. And from educational insight segment, that is all for us, but I'm not just saying goodbye as yet because tomorrow our hujjaj are going to Mina. So they are preparing currently. The 1,000 chosen Hujjaj are embarking on a journey, a life altering journey. And tomorrow, Alhamdulillah, officially 5 days of Hajj commences tomorrow, and Hujjaj in Makkah or Azizia, they station. Not sure what is the vibe like in terms of that. Is everybody going to be departing from Makkah or Azizia? But they're going to prepare for the first day in Mina tomorrow. So tomorrow will be the 8th of Zilhijjah in Makkah in Saudi Arabia, and 9th Zilhijjah will be Thursday, and Eid al-Adha will be observed on Friday in Saudi Arabia. So we're going to go for a short break, and thereafter we're going to be speaking to South African citizens who, alhamdulillah, the Almighty has accepted their labbaik, and they are currently preparing for their trip to Mina tomorrow on 8th Zilhijjah. So I will be speaking to Sister Nazim Khan, and they're going to tell us about how the preparations for Hajj is going. So let's go for a short break, and when we come back, let's cross over to the Kingdom of Saudi Arabia, inshallah.